So you can always look over it with your handouts. Number 3, how often is HCPCS Level 2 Permanent National Codes updated? Can everyone hear me? Because I see a few saying can't hear. Just want to make sure you guys can hear me. Okay. Yes, you can. All right. Mhm. All right. For number 3, it's national codes are updated annually. So for number 3, it's A. And number 4, this is where we're going to start using, this is number 4 is going into anesthesia, right? So what's the correct anesthesia CPT code for surgery performed on the frontal lobe of the brain? Okay. Another thing I showed you guys last week was how to look it up by body part in the anesthesia section. Also remember that in your CPT, I don't know why it's cutting out. Let me just see if I can adjust my volume here. One second. Let me just see if I can, does that sound better? Just want to make sure you guys can hear me. All right. Okay. All right. All right. Hopefully you can hear me now. I did try and adjust the volume here. Okay, for number 2, someone said they missed number 2. Number 2 is C. And I will be sending that answer key along. I am also recording this, so you'll be able to replay it. We're down to number 4. And number 4, what I was stating was in your CPT book, please remember that you can actually go to the index in the back. We're going to do it together. So if you have your CPT book, and you can turn directly to the term anesthesia. Some people like to do it this way. Some people like to just go page by page in the anesthesia section. But I just want to give you different options, and whichever way makes you feel comfortable, that's how you will use it. So if you turn to page, make sure I have my right book, 780 in your CPT, you will notice that it has anesthesia. So all of the procedures for anesthesia are also located in the back of the book. But you would need to know what you're pulling out and what you're looking for, right? So for number 4, it's talking about frontal lobe of the brain. So basically what you're going to do when you're in the back of the CPT and you're looking at anesthesia on page 780, we're talking about anesthesia performed on the frontal lobe of the brain. So we're like, what's the body part, right? Remember, what's the body part? So here the body part is brain. So if you're looking at 780 and you go to anesthesia and then you look for brain, it's going to give you a code range, right? It tells you C code 00210 through 00218. And then it has another section of codes 00220 through 00222. So what you would do is turn to those codes and you would see that you would choose 00210. Okay. And that represents anesthesia for intracranial, which means inside the cranium, brain procedures, because that's what's inside your cranium, your brain. Okay, so for number 4, the correct answer is D as in David. Number 5. And if you have any questions as we are going over these, please make sure I am checking the chat box at the same time. Number 5, patient seen in the OR, arthroscopy, right? Patient seen in the OR for arthroscopy of the medial compartment of, what's the body part? Is the knee. A meniscectomy was performed. What's the correct coding to report for this anesthesia? So for number 5, same thing. If you're in the back of the book, and I'm trying to give you different ways, so when it's test taking time, you can think of ways where it was a little easier for you. You're not flipping through all of the pages, or it's guiding you to the correct range of codes. So for number 5, you can go straight to anesthesia, which is on page 780. You can look for knee, because that's my location, right? That's the location. And where do you find knee? That's going to be on 781. And then it gives you a range of codes. And based on the arthroscopic procedure on the knee, we would be using CPT code 01400. So number 5 is A as in apple. And number 6, this is back to the HCPCS. Okay, and remember in the HCPCS book, I need to make sure that you tab your modifiers. Okay, so for number 6, the correct answer would be D as in David, which stands for intrathecal space. Subdural space of the spinal cord, that's going to be D as in David for number 6. Okay. Number 7. Again, you would have to be using your HCPCS book, and you can go straight to the index for number 7. And it tells you, okay, there's no body part here, but what is the procedure? What is it that they're getting ready to do? And so you can see parenteral nutrition, and so that's what you would look up in the index. Okay? And once you get there, it's going to give you a code range. Gives you a code range there for number 7. And then once you review those codes, you would have selected B4168. So number 7 is C as in cat. Number 8 is A as in apple. So it's asking the correct HCPCS level 2 code for a removable metatarsal foot arch support, which is pre-molded. So you're maybe asking yourself, what would I underline or highlight? And I want you to do it if you have this question incorrect. Make sure you highlight where it says support. It's a support arch are the keywords. Okay, so you would look for support. Support of what? The arch. Then you're directed to see your code range. They'll give you a code range, which would be L3040 through L3090. And then you would select L3050 as that code represents the removable metatarsal foot arch support. So number 8 is A. Okay. Number 9. Number 9 is B as in boy. And number 9 you may see again. I've seen that quite a few times. You may see it on your mock final. And remember that they will have about 5 questions on the national exam in reference to HCPCS. So I hope you did well with that. Please let me know if you didn't so we can spend more time talking about it on a one-on-one basis. But for number 9, your answer should be B. B as in boy. Number 9 is B. Number 10, now we're going into the digestive system, so we're back into the CPT. We're back into the CPT manual. And so what you're looking up, also, just like we did anesthesia in the index, you can do the same thing with the term laparoscopy. Remember, all the procedures that are performed laparoscopically are listed in the index under the term laparoscopy. Let's see what page that's on. Yep, so that's starts on page 893. Okay, so that's where all your laparoscopic procedures are, in the back of the index. Or, of course, you could be in the digestive system, but you always want to go to the index to look for the actual procedure. You want to look for the procedure, right? So if I'm looking for the procedure in number 10, you have to think about what are the keywords. This is what I want you to highlight in number 10. So we know laparoscopy, that's telling you the approach, right? That's how it's being performed. And if they're talking about a colectomy, remember, we're in the digestive system. So a colectomy is in reference to the colon, right? And it also tells you it's a partial colectomy. So you can go laparoscopy on page 893. And then you can go to colon, right? Because that's the body part. And what are we doing to the colon? We're doing a colectomy. Is it a total or partial? In the question here, it tells you it's a partial. And then it gives you a code range. It gives you a code range. And what's also important is that it states anastomosis and coloproctostomy. Okay. So for number 10, your answer should be D as in David. D as in David for number 10. Number 11, okay, what is the correct code for a complicated? It's giving you, remember, your medical terminology words are procedures, right? So I'm looking for my terminology word in my question. So if I'm looking for a terminology word in number 11, I can see nephrolithotomy, right? That is the procedure. That's the procedure. Okay. Once you turn to that code in the, that term in the index, it's going to give you a code range. And remember here, it's also telling you that it was complicated. So it's giving you additional detail about number 11. It was complicated. Okay. So for number 11, the correct answer is C as in cat. C as in cat for number 11. Okay. Number 12, same thing. What am I looking for? I'm looking for my terminology word. What is the terminology word in number 12? Cystourethropy, right? Because you're looking. Scopy is to view in number 12. And what else are they doing once they get in there? They're going to look and they're going to do a brush biopsy. So they're going to do a biopsy. What type of biopsy? Brush. Let's take a look at this. I want you to turn in, because I want us to, kind of walk through these. In your index, you're going to look for the term cystourethropy, which is found on page 821 in your CPT, 821. And then what did we say was going to happen? They're getting ready to do a biopsy, right? And then what type of biopsy? Brush biopsy. Gives it to you right there, 52007. So number 12, of course, you wouldn't take it from there. You would want to validate it and just make sure you read it, right? So you would turn to that CPT code. But number 12 is A as in apple, 52007. Okay. I think we're getting the hang of it. Number 13. Number 13. Okay. So let's see what's going on with 13. And on number 13, what is the CPT code for? What are we getting ready to do? Removal of a foreign body. And where is the foreign body? In the esophagus. And it's telling you via the thoracic area. So what would I highlight in my question? I'd look for what's my body part? It's going to be the esophagus. So I'll highlight it, put a 1 over it so you can know that's the first word that you're looking up. What are they going to do? They're going to remove, right? So you'd go esophagus, removal. What are they removing? A foreign body. Okay. Once you get there, it's going to give you a range of codes. And so what's important now is the approach on how it's removed. Okay. And it's telling you it was via the thoracic area. And it tells you in the CPT code book, the removal of foreign body from the esophagus is 43020. If it's a cervical approach, right? And 43045, it's a thoracic approach. So it gives you the approach with your CPT codes. And so what approach are we looking for? We're looking for thoracic. So for number 13, your answer is going to be B as in boy. 43045. Okay. Number 14, very important for you to know. I would actually put a star next to that. I've already told you need to know the parts of the large and the small intestines. You never know what they're going to ask you, so it's good to just have those written in the CPT or look for the illustration in either the CPT or the I-10 and make sure you can identify the parts of the large and, I'm telling you, and the small intestine, right? So number 14 is going to be C, okay, because you have your cecum, then you go up, which is ascending, go across, transverse, descending, you're going down, and towards the end of that colon, you're going to find the sigmoid, the rectum, and then your outlet, the anus. Okay, so number 14 is C as in cat. Number 15. Number 15 is I-10. You guys did really well on I-10 during the midterm. So number 15 is B as in boy. B as in boy. Number 16. Number 16 is A as in apple. And for 17, we're looking at the procedure, right? What's the procedure? Okay. Hemicolectomy is the procedure. Can that be found? Let's see how we're going to look up hemicolectomy. Number 17. And just so you know, the term hemi also means partial, right? So on the other question, it did say a partial colectomy. Sometimes they'll say hemi, because hemi means half or partial. So what you could do, same thing like you did before, you can turn to the procedure, which is a colectomy. Now you know what type of colectomy, because hemicolectomy means partial, right? And then it should direct you to CPT code 44140. So for number 17, your answer should be A as in apple. A as in apple for number 17. Hemicolectomy means it's a partial colectomy. Anytime you see that term, you're like, okay, I'm going to colectomy and I'm looking for partial. It doesn't give any additional information, so that's what you code, and your answer would be 44140. Number 18, moving on. Number 18, This one, I remember us going through that, right? So we spoke about the tonsils and adenoids and making sure you're paying attention to the age of the patient, whether they also had adenoids removed. So let's look at number 18. So a 7-year-old female presents to the same day surgery unit for a tonsillectomy. So I'm going to highlight that because that's a procedure, right? During the surgery, I've also highlighted the age of the patient. During the surgery, the physician notices the adenoids are very inflamed and must be taken out as well. So the adenoids, although not planned for removal, are removed once the tonsils are taken. So now we know it's a adenoidectomy and a tonsillectomy, which leads you to say, okay, this is going to be one of those combination codes. And again, the patient is younger than 12. So your answer for number 18 should be 42820. So A is the correct answer for 18. Number 19, moving along. Same thing. Number 19, 12-year-old patient had adenoidectomy in 2013 and a second adenoidectomy this year. Okay. Remember our little conversation about that? That's going to be that regrowth, right? Because it's coming back. She's having the second one performed this year. So, or is it just the adenoids? Let's see. Number 19. So that's going to be, that's going to be the secondary, the regrowth. Right, so that's going to be 42836. Yes, so the answer for number 19 is C as in cat. And the key word there was regrowth because it told you about, what happened with the patient in 2013, and then they had a second one this year. Okay, so they're asking what code is reported for the second. So that's the regrowth, 42836. And how old is that patient? Patient was 12. Yep. All right, number 20. Number 20, the correct code for a 30-year-old obese patient with a body mass index of 32.5. Okay, so they're just obese. It doesn't say morbidly obese, so you can't choose E6601. The correct answer for number 20 is A as in apple. A as in apple for number 20. Number 21. Okay, let's see what's going on with 21. What CPT code or codes, right? Because you have your S in your parentheses, so they're saying, hey, it could be one, it could be more than one answer. What CPT is reported when a physician makes two separate incisions? I think we've spoken about that. That's for you to understand modifier 51 and modifier 59, right? And I said separate incision, separate site. What modifier would you be using? For number 21, you should have chosen D as in David with the modifier 59. Yes, perfect. And sometimes that's why I like the modifiers, guys. Remember, because it gives you additional information. And for this one, you didn't even need to look anything up, right? Because you know that modifier 59 is separate incision and a separate body part because they were doing, let's see, they did an appendectomy and also a cholecystectomy. So they're removing the appendix there and the gallbladder. And so modifier 59 would be added to that second CPT, not the first one, the second. That's the additional procedure. Moving on to number 22. Number 22, again, this is in reference to gastric bypass surgery or the lap band. And you will have a question similar to this one, either on the mock final or the exam. So make sure, I hope you get number 22 correct. Number 22, CPT and ICD-10 they want. for the gastric restriction. And what are they placing? It's a gastric band. Okay. They're placing a gastric band for adult patient who is morbidly obese. So now we're going to use our E66.01, and their body mass index is 43, and they have uncontrolled diabetes. And they have uncontrolled type 2 diabetes. So for number 22, the correct answer is C as in cat. C as in cat. Number 23, recurrent, unilateral, reducible femoral hernia repair. Okay. For number 23, how would I look that up? I can go to, in the index, I can use repair, hernia. What type of hernia? You need to know the type of hernia. It told you femoral. What else do you need to know? It's recurrent, and it's also reducible. So all the keywords there. That should lead you to CPT code 49555. Okay, 49555. And the correct I-10 code for number 23 is K41.91. And again, if you're a little confused, remember, if you have questions that have both CPT and ICD-10, you can always look both of them up or think about which your strong points are, because you know your I-10 is going to give you exactly, it's going to read exactly what it needs to say. So you could always double check with your I-10. That way you would have known, okay, it's either going to be A or B, right? Because you would have had your correct I-10 right away. And then you could have just looked at your CPT and narrowed it down from there. Okay, that's a time-saving technique. Number 24, what CPT codes are reported for endoscopic? That's important to me. I always want to know the approach. Endoscopic direct placement of a percutaneous gastrostomy tube for a patient who previously underwent a partial esophagectomy. Okay, so number 24. Okay, let's see. I hope you didn't code the, okay, so you're not going to code 43116 because that's also part of it. It was not performed. You have to think about what was actually performed. Okay. The correct answer for number 24 is D as in David. And I think I told you that's a common one. That should be one that you should have highlighted or become familiar with. Okay. So number 20, someone was asking me about number 23. Number 23 is B as in boy, and number 24 is D as in David. Okay. And number 25. So they have an abscess around the anal area. What are they getting ready to do? They're going to incise and drain, incision and drainage, right? During the course of performing an internal or external hemorrhoidectomy. Okay, so first of all, let's see what we're pulling out here for number 25. Hemorrhoidectomy is a procedure, right? So you can highlight hemorrhoidectomy. And it's simple because it didn't give you any indication otherwise. So that would be your 46255. Since it's internal and external hemorrhoids were removed. And then your incision and drainage code for the abscess. You, as far as how you would look that up, you'd go drainage, abscess, and then you'd have to look for the location. So it's, remember, we're not going back to integumentary, we're in the digestive system. So you go drainage, abscess, and then you look for the body part, which is anal. And then it would give you a code range. And the correct code to report would be the CPT code 46050. Correct answer for number 25 is A as in apple. Number 26. Moving on, number 26. All right, here we go. Let's see. How do you report a screening colonoscopy performed on a 65-year-old Medicare patient? You know, once you see the term Medicare, what your answer needs to begin with, right? So that right away, you can get rid of C and D. Right away, you can get rid of C and D, right? Patient with a family history. Remember what happens when you have a family history? The patient now becomes high risk. Okay? And it also says the patient's 72-year-old brother was just diagnosed with colon cancer. And the physician was able to pass the scope into the seek of what CPT and ICD-10. So again, once I saw a Medicare patient, I already know my answer needs to begin with a G. So I've ruled out letters C and D. And now I'm like, okay, I also see the brother has colon cancer, just been diagnosed, and he also has a family history of colon cancer, which now makes that patient become high risk. If the patient is high risk, the HCPCS code is going to be G0105 for high risk. Correct answer for number 26 is B as in boy. Number 27, so ICD-10, correct answer for 27 is B as in boy. And that would be just as simple as looking up those codes there. Or you can go to gastritis acute with bleeding, and it should take you there in your ICD-10. Okay, number 28. Number 28. I just wanted to clarify, Ashley, you had a question. The question says or, not and. What number is that in reference to? Number 27 is B. I just wanted to know what question you were referring to, Ashley. What number? 25? Okay. Let me just go back up here for a second. You know what, Ashley, I'm glad you brought that to my attention. You're going to see this question again because it says internal or external for number 25. It should have said and in there. I think they had that incorrect because it can't be internal or external being removed. It would be and. So that is a typo on the AAPC's part. So kudos for pointing that out. It should be and because you can't have internal or external. It's either or both. And for this particular example, for number 25, it should have said and. So that's why that answer is A. Okay. Yeah, I can see how that threw you off. But I'm glad you were able to pick that up. So 27, I said is B. 28, these are just terms. I love terms because I don't know what is going to be asked. What's going to be asked. So like if they start talking about terminology for different body systems, if you start to see that in your homework, I'd write that terminology in my book also. Number 28, what produces the male hormones? It's going to be A for number 28. Testes are the male reproductive glands, and they're responsible for producing testosterone in the hormones. 29, let's look at 29. Patient comes in for removal of calculus from the renal pelvis via renal endoscopy through an established nephrostomy. All these terms, right? So if you go to endoscopy, you can go to renal, and then it's divided into 2 code sets. And the difference between the 2 code sets is whether the procedure is performed through an established nephrostomy or pilostomy, or new nephrostomy. That's how they're broken up. And according to this question, number 29, it was an established nephrostomy. So you would go, as far as looking it up, you'd go endoscopy, kidney, right? Kidney, because nephro means kidney. And then, so endoscopy, kidney, and then the removal of calculus. And that should arrive at CPT code 50561. Number 29 is A as in apple. Number 30. This is also transurethral resection. You always want to look at the size, right? We got the size in your CPT book, the size of the tumor, and there it tells you 3.0 for number 30. 52235. So you're the correct answer. Let's see if I can 5223. Yep. So 52235 right on page 333. And I believe this was also one of the need to knows, right? So that means you need to make sure you understand how we got to that answer. But it's right there because you guys highlighted it in your books. Okay, number 31. Number 31. Let's see what's going on with 31. Patient presents for, here we go into the penile prosthesis through an infected field. Number 31. If you were looking this up in the index, because I know we spoke about, let's see. I know we spoke about the things to highlight on that page. But if you're looking it up in the index for number 31, prosthesis, he's coming in for a replacement of the prosthesis. So you can go to prosthesis. For what's the body part? It's going to be the penis. And what are we doing? We're replacing it. So it's prosthesis, penis, replacement. And it will give you a code range. Okay. For those, let's see. So you would use, if you're going to use 54411, I just want to go to that page for a second. I'm looking at CPT code 54411. That is on page 342, right? That's where your penile prosthesis is. Remember, you should have your need to knows written down, right? Penile prosthesis and where to go to find them. So penile prosthesis is on page, starting on page 342. Okay. In order to use letter A, 54411, it would have to state multi-component. So you might want to write multi-component next to 54411. So the correct code that you would need for number 31 would be 54417, which indicates the replacement of the prosthesis through an infected field. So that's important too, right? Infected field, make sure you highlight that. Okay. So that would be your answer. So number 31 would be B as in boy. We wouldn't choose C or D with that 11004 because there's no information on debridement. So we can't just code it unless there's documentation there to support it. So that's why we wouldn't pick up that integumentary debridement code, right? They haven't mentioned that. So the correct answer for number 31 is B as in boy. Number 32 is an I-10. So number 32 is C as in cat, Always want to put their weeks of gestation. So that Z3A point, you can see she's 30 weeks, so that's why they have 0.30. If she was 32 weeks, it would be Z3A 0.32. So the last two characters are to represent the weeks of gestation. Okay. But for number 32, correct answer is C as in cat. Number 33, B as in boy. 34, VBAC. Remember, vaginal birth after C-section. I like, that's going to be D, right? But I do like A. I like the answer for A, virgin before antenatal care. It would be a good one. All right, let me just look at this. I see a question in the chat box in reference for number 31. The question 54417. Well, if you continue reading, it says removal and replacement of non-inflatable or inflatable for number for CPT code 54417. Okay. All right, let me keep moving on. Number 35. Number 35 is D. D, all of the above are part of the female reproductive system. Number 36. Number 36. Let's see what's going on with number 36. I want you to put a star next to this one too. Okay, and I think we did put the different parts of, we wrote the different parts there, right? So number 36 is patient with genital warts has cryotherapy for an extensive number of lesions on her mons pubis, labia, and perineum. How is the procedure coded? And just remember, the mons pubis and the labia are part of the vulva, right? So in the CPT, as far as us looking it up, what did she come in to have done? They were going to destroy some of those lesions, right? So you go to destruction. Remember, whenever you see destroy, you go to destruction. Just what are we destroying? Lesions. So destruction, lesion. Where are the lesions located on the vulva? Right? And it also states that it was extensive. Okay. So the correct answer for number 36 is B as in boy, 56515. 37. Number 37, patient has total abdominal hysterectomy, bilateral salpingo-oophorectomy, or you do have the acronym there. Number 37, how would I look that up? If I had to, what would I pull out of that? You need to know what that stands for, first of all. So we know it's a hysterectomy that she's coming in for. So in the index, your first term to look up would be hysterectomy. And then remember, you need to know the approach. How are they going to remove the uterus? And TAH stands for total abdominal hysterectomy. So it's being removed through the abdomen. So you'd have hysterectomy, abdominal, is it partial or total? And T stands for total. Okay, so hysterectomy, abdominal, total. It would give you 3 codes to choose from. And she also had a bilateral salpingo-oophorectomy, which is the removal of the tubes and the ovaries. So CPT code 58150 includes with or without removal of tubes or ovaries. So number 37 is A as in apple. Okay. Number 38 should be a easy one for you. Number 38 is B as in boy. Number 39 Number 39, we spoke about that. Also, number 39 is C, considered a spontaneous abortion or miscarriage. It just happened, right? Spontaneously. Right? Number 40. Number 40. What did the patient have? They have a vaginal hysterectomy with bilateral salpingo-oophorectomy. Right? So same, it's just that the approach is through the vagina. Right? So for number 40, the correct answer is D, as in David. 41. 41, for sure, you're going to have a question in reference to delivery. So let's make sure you get this one. Let's just look at it and see what we need to pull out. Okay, so for 41, she's pregnant, comes to the hospital, she's in active labor. The obstetrician providing her prenatal care, so the care before, is contacted to come deliver the baby, to perform the delivery. What does the provider deliver? He delivers twins. Okay, and it also says that the obstetrician will also provide postnatal care. So here it's giving you the global, right? It's telling you I'm going to take care of her. I've taken care of her before. I'm going to deliver the baby, and I'm also going to take care of her and the baby after delivery. So that's going to be a global code. So for number 41, you have to think about the global code for, if it doesn't state cesarean, we're going to assume that mom delivered vaginally. And I don't see cesarean here. So we would select the global code for the vaginal delivery, which is 59400, and then your 59409 for baby number 2. Baby number 2. So the correct answer for number 41 is B as in boy. Okay. Number 42, if a non-Medicare patient has an age and gender appropriate preventative medicine exam, this is coded with the age appropriate preventative medicine codes from the E&M chapter. See, they try to confuse you with these questions because if you look at the last sentence, it says, if a Medicare patient has a breast and pelvic exam, how is it coded? They could have just said that in the beginning. We would have been like, B, done, once we see Medicare, right? So the correct answer for 42 is B as in boy. Okay. 43 is another delivery question. I strategically picked these. So let's look at 43. She's 27. She delivers twins, right, by her regular obstetrician. First baby is delivered how? Vaginally. Second baby is delivered by cesarean. We already talked about which delivery method trumps the other. When I say trumps the other, meaning which one is more labor intensive, right? So that would be the cesarean, right? Both are delivered without complication. Patient will return in 2 weeks for her postpartum visit. What's the CPT code? So for number 43, we're not going to choose C. I'm sorry. We are going to, 59510 is great. Oh, wait a second. Yep, because of the vaginal delivery. So for number 43, the correct answer should be D as in David. You have your 59510, which takes precedence because it is the global and cesarean delivery. And then the 59409 for the second baby that was delivered vaginally. So for number 43, the correct answer is D as in David. Number 44, 27-year-old, comes in again. Everybody's having twins, delivers twins by her regular doctor by cesarean delivery. Both are delivered without complications. Patient will have postpartum care in 2 weeks. What is the correct CPT code reported for this service for number 44? So number 44, the correct answer should be A. Remember, if it's cesarean, although they're having twins, they're both being delivered through the same incision. So that's only captured once. So for number 44, the correct answer is A. Okay, number 45. Number 45. Let's see. Patient with a previous cesarean. Remember VBAC. There's a section for VBAC. Hopefully you're in the book also. Go to the page that has those for the maternity care and delivery. Okay, so remember your VBAC is going to be on page 363, all your VBAC procedures, and they will have the acronym VBAC there. Yeah, 363 under delivery after previous cesarean delivery. And let's see what's going on. Vaginal birth after cesarean. Look, it's also called a trial of labor after cesarean. With her second child, during the delivery, her uterus ruptured. She had an emergency cesarean. I'm just looking at my selections. She had an emergency cesarean section followed immediately by a hysterectomy to remove her ruptured uterus. Mom and baby survived, which is great. The same obstetrician provided her antepartum and postpartum care. What are the CPT ICD-10 codes? First of all, number 45, you should be 59618, because that was her attempted vaginal delivery after previous cesarean delivery. So the correct answer for number 45 should be B as in boy. B as in boy. Because she had twins. Okay. Gotta capture the second one. Okay. So look for the second one on number 45. B is the 581. Yeah, the number 45. 45 is B. We have, so you should have your 59618 and then your 59525 for number 45. Number 46, almost there. I suggest that you have these modifiers written in your anesthesia section of the CPT, or make sure that you have your HCPCS modifier page tabbed. For number 46, the correct answer is C. QX is used for CRNA services. Right? So those particular modifiers are going to be found in your HCPCS book. Number 47, important too, because you can write these in your anesthesia section. What organs are found in the lower abdomen? Because remember, in anesthesia, they just have it split lower and upper. Number 47 is A. A as in apple. So if someone's coming in for appendectomy, you know that's going to be part of the lower abdomen. And number 48, number 48, back to anesthesia. This is for a cast application. And remember again, in the index, you can go to anesthesia and then you can look straight for cast application and where it's being applied. Now, the wrist is considered part of the forearm. Okay, so they're not going to have wrist there. Okay, so you'd go anesthesia, cast application, and forearm. That's where your wrist is located. So if you didn't know that, make sure you jot that down. Number 49, let's see. They just want you to use your CPT book, and they want arthroscopy of the shoulder, anesthesia for arthroscopy of the shoulder. So again, you can go back to the index. I like using the index for anesthesia to just cut time. But you can go anesthesia, arthroscopic procedure. What's the location? It's going to be the shoulder. Then it will give you a code range. And you should have come up with, for number 49, B as in boy, 01630. Let me see. Okay. And the last one, someone just asked about 48. 48 is A as an apple. A as an apple for 48. And the last one, number 50. So they're asking about anesthesia codes, right? So we don't even, if they're asking about anesthesia codes, you can cross out A right away. We're staring at them. We know the categories that they belong in. It says, what is the appropriate anesthesia code for an obstetric patient? So we know where obstetrics is in the anesthesia section, right? So you're turning to anesthesia and you're looking for obstetrics, which I believe is the last page in anesthesia. I'm just turning there. Yeah, page 62. So what do they want to know? Obstetric patient who had neuroaxial labor. Okay. Well, that looks like CPT code 101967. Provided by the anesthesiologist, the delivery was expected to be a normal delivery. However, the obstetrician performed a cesarean delivery when the fetal heart rate dropped. What's the CPT code? So you would have 01967 and 01968. You'd have both of those. Can't just have 01968 by itself because that is an add-on code. So already you would have been able to take out A and C, and you would have been left with their 01967. But they were they were delivering the baby cesarean, right? Cesarean deliveries. That's why you have the 01968 for number 50. Okay. I'm just going to open the line for a quick second, just in case anyone has any questions in reference to number 1 through 50. Okay, so
I have a quick question.
Sure.
Oh, I'm sorry.
Well, I was just going to real quick, before you ask your question, I just saw one pop up in the chat box.
Okay.
For number 26. Number 26, they wanted to know how you would look that up. Okay. Keyword for number 26, what are they coming in for? They're coming in for a colonoscopy screening, right? So as far as the HCPCS, the first term you would look up would be colonoscopy. And what's the colonoscopy for? It's for a cancer screening. Okay. And then also that patient is high risk. Okay. Or you can do, that's for the HCPCS portion of it, which would lead you to G0105. And as far as the I-10 portion, it's a screening. So when you're looking up in I-10 in the index, you would look up screening. What type of screening? It's a colonoscopy screening. And that's what would take you to the Z1211. And then you also have to report that this patient is high risk due to the family history. And that's when you would have your Z80.0. And as far as looking that up, you just go to the index. You go diseases and injuries for history or family, and then you go malignant neoplasm, where gastrointestinal tract. That's how you get your Z80.0. Okay. And I don't know if everyone was here in the last presentation. We did cover how to use the HCPCS book. It's just like the CPT and ICD-10 is actually easier. I think many of you agreed that it was easier to use. Okay. And I'll get with you on that in reference to how to look up the HCPCS if you need more detail. So no worries. Does someone have another question?
Yes, I wanted to know about number two. That's where the mic or the volume kind of went out when you were talking for me.
Oh, number two was just that
Yes.
you're looking for what? Remember that HCPCS are like medical equipment, drugs, and stuff like that. So if they're saying wheelchair for number two, I believe. Let me go back to this question.
Yes, wheelchair.
Yeah. So that's exactly what you would look for in your index in the HCPCS would be wheelchair. You
Okay.
just look for the term. For this particular question, they just wanted to know. Number two, C, the code range for wheelchair. But usually if they're asking, sometimes they have something like swing away leg, something like that. It would be more detailed for you to select your code within that code range. But for this question, they just wanted to know what the code range was for wheelchair.
And the answer was C, correct?
Yes, the answer is C, correct, for number two.
Okay.
All right. Anyone have any other questions? 50 is D. Yes, 50 is D. Any other questions? Everyone's saying no. Just want to make sure before we move on into the PowerPoint. How do we do? How do we do on it? Uh-oh. Wrong response. Well, let's see. You don't want to miss more than, well, there's only 50 questions, right? So you can't miss more than 14, no more than 15 questions. Well, 15 would be a 70. So hopefully no one missed more than 15. If you did, you only missed 2. That's awesome. Okay. That is perfect. So if you miss more than 15, we need to be doing some type of 101 time scheduled. If you miss 10, that's an 80. That's awesome. If you miss 5, a 90. I'm feeling good about that. Just think about this, guys. Anesthesia is a section all by itself, right? So I know you're comfortable with anesthesia. So, like I had them do on Saturday, I was like, think about the sections that came easier to you. We're not going to do open the book, start from the front, I want you to think about the sections that come easier to you and use that as your plan of attack or your strategy to take that national exam. Because if you can get anesthesia out of the way, I think we're good with female, right? We're good with female. If you miss,
The deliveries are a little tricky to me.
really, I love the deliveries.
And I do too. But
It's just
it's
it's
just a,
just trying to figure
yeah.
them out, right? Just trying to figure out,
Hmm.
okay, which one. Well, just remember, as far as the deliveries, remember if they're talking about a vaginal delivery, and I can guarantee you the questions are going to be in reference to twins because just delivering one baby is too easy, right?
Okay.
So you just have to think about the different scenarios with the twins. That's why I tried to pull them and put them in that particular homework set. So just remember,
Okay.
if it's cesarean, that's going to be the most labor intensive as far as how much work. And remember, the one that's most labor intensive, you're going to list it first because of reimbursement. And if they have twins and it's cesarean, then they're only going to use that one cesarean code.
Got it. Okay.
That's what you have to remember when the twins are coming out and they were delivered cesarean, they're taking the babies out of the same incision. So they're not going to pay for the additional baby. Sometimes some providers, depending on the payer, they will add like modifier 22 to get a little bit more money. But for AAPC purposes, you are just going to choose just the cesarean code for twins. And if it's vaginal twins, then you'll have the global. You have to make sure though, like the question had stated, that the doctor saw the patient before he delivered the baby. He's also going to see the patient after, right? Because I don't
Okay.
want you to think about someone that's in New York and they had all of their pregnancy treatment performed there, but then they came to Georgia and all they did was deliver. So they can't get that global, that 59400. That provider can't get that because he didn't provide the prenatal care. Right? So you have to read your question. Is he just going to deliver the baby and then do like aftercare? Because there's a code for that, right? Or is he just delivering the baby only? So you have to kind of, pay attention to what it is exactly that provider is going to do. Okay. If you missed 8, I see someone missed 8, 84. I am happy with anything 80. 1570, borderline. But I'm sure if you look back through, these are very good questions that I picked out for you guys. Make sure you understand these. If you don't, you need to let me know so we can get some time one-on-one. If you're not meeting with Shamira, one-on-one, so we can break it down together. Okay. Or if you do have independent sessions with the tutor, make sure you let her know which ones you're getting incorrect so she can just focus on that. We don't need to focus on everything. Focus on my weak areas. Use your time wisely. Right. Anybody have any other questions? I will send the key. I'll send the key for tonight, for this homework that we have up on the screen. I'll send it out with tonight's attachments. Well, you'll get them in the morning, but after the recording has downloaded. So I will send the key for this. So no worries if you didn't get to go through or if you needed an explanation. Remember that the key does have the rationale. But hopefully we all did well. Did anybody miss? I know you may not want to volunteer that information, but if anybody missed more than 15, you definitely need to be reaching out to me. Okay, I'm offering my assistance. You definitely need to reach out. We can do a one-on-one webinar. We can talk, we'll talk it out. No one's volunteering. Okay, no problem. But remember, I'm available. She said she's available, so I'm going to tell her I need help on this. Please, please use me. That's why I'm here. All right.
May I suggest something?
Please.
I've found that the AMCI ICD-10 on YouTube has been excellent as a supplement to this class.
Okay. What's it called?
And
AMCI?
AMCI, and it's also done by AAPC instructor.
Okay. All right.
So it has really been great for a backup for this class and
You
goes
mean
into a lot of detail that helps me understand things in depth.
in reference to I-10? Or do they do
I
PPT too?
CPT. He does the whole program on YouTube.
Oh, good. See, and there's so many resources. Like I tell people sometimes when they're like, I'm not great on terminology, YouTube has everything. As a matter of fact, that's how I upload some of these. You know what I mean?
Okay.
That's what I'm doing right now. So,
She does terminology. She goes and she shows videos on different parts of the body, on segments, how to count the disc and segments. So
hmm
it's really been excellent.
especially, can you type in the link or maybe log on to YouTube, copy and paste the link into our chat box so those that are interested can just copy that link and then they'll have it because it is important. And you have take the additional initiative to say, okay, let me see if I can find something more visual to explain these topics. And that's what it's all about. I know I'm providing information. I know you have textbooks and workbooks, but it's great to have just different formats to receive the information. Okay. So they say
And I just
AMCI.
want,
Yes, please go ahead.
I just want to just double check the blue book The medical coding training CPC book,
Mm-hmm.
that particular book we cannot use on the national test. Is that correct?
That is correct. Remember, that's your textbook, which is basically just telling you how to use your coding manual. So you can't use it. The only thing you can use on the exam is going to be your HCPC, CPT, and ICD-10. And that's why I say, as we come along different things, come across different things like different terminology for different body systems, take
Okay.
advantage of that and write those terms in your book. Like I said, you could have one page. I've always suggested that. And you can tab it terminology and you can break it down by body system, whatever's going to work for you. Or you may want to write the top 10 that, use the terms we came across in the homework, like male, and write those in the male section. Or you could just have them in one area. You have to start to organize your books
Mm-hmm.
for quick use. So when it's time to take the exam, you're not scrambling for information. You should have a tab somewhere that's going to take you straight to that information. Straight to that information. And when I tell you, or when I send and I provide you with need to knows, it's not because those are the things that I like, right? When I say need to know, it's because you need to know it. Right? And so if I've sent you need to knows and we're talking one on one and I ask you a question, I think you should know that because these are the 10 things or the 10 concepts that I'm telling you is important for you to know to be successful on this exam. So you may need to take, because we're almost wrapping up. Like after tonight, what are we doing now? We're doing the sixes, right? Um, as a matter of fact, after we finish the sixes, which is the nervous system, endocrine, and the eyes, we're done with body systems. We're done with body systems. Then we're moving on. Sevens is going to be radiology. Eight is lab and path, and nine is medicine, and nine is also E&M. So we're basically done with the body systems as far as terminology, medical terminology is concerned after this week's presentation. So again, you have these resources because when, sometimes we're like, I'm not understanding. You have your books. You have your textbooks. You also have your workbooks. I've also provided you the key for both the textbook exercises and the workbook exercises in week 2. So, what are we doing with that? What are we doing with those? Once I have lectured, sent you the PowerPoint, what are you doing? You have to have a strategy on how you're studying for this exam. You have to have that strategy on, okay, let me read my either watch the video presentation or look through the PowerPoint, or the areas that you're not understanding, there's a section explaining it in your text. Or you can say, Geneve, I'm not understanding, collect anything to do with digestive system. Let's talk about digestive system. What do I need to know? I'm not picking that up well. And we can talk about that. But you have to come to me because I'm not going to know. I can get feedback from you on how you're performing on your homework and things like that. But I don't know the deep issues if you're not understanding a particular topic or concept. So you do have to let me know. I can tell you that there's a couple of you I speak to religiously every week. And those are the ones I know that are doing well, right? Because they reach out to me by themselves. I am available. You also have Shamira that does the tutoring. So you have to let her know, utilize this time. It's only 16 weeks. You're not going to master coding. The CPC is an introductory course. It's not for you to master how to code. That comes with experience. But you do need to know the basics, and the fundamental parts and steps of it to be successful on the exam. And again, the exam is multiple choice, just like we looked at a couple of the questions. Some of them we can rule out right away, which will save us some time. But the answer is there. So you have like 2 minutes to look them up. Anybody else? Any other questions, suggestions, tips to share? So AMCI, they're saying, is a great channel on YouTube to help with CPT and ICD-10. All right, so I'm going to switch over and pull up the next PowerPoint. So what we're getting ready to start right now is going to be the nervous system and endocrine. Endocrine actually starts on page, just so you can know where we're going to be. Endocrine starts on, wait, before I go to endocrine, we need to be on page 364. 364. Let's get the slide up. 1 second. Okay, so everyone should be able to see my screen. We're on the endocrine and nervous PowerPoint, and I am on page 364. As you can see, the endocrine is a very, very short chapter. It's only a page. It's not even a full page. It's not even a full page. So you should be looking at page 364 right now. Can everyone see my screen? Just want to make sure. Someone just say yes in the chat box. Great. Thank you. All right. So there's a couple of things I want you to do. First, you need to make sure you have your highlighters and your pens ready so we can do some highlighting and underlining. On page 364, under the endocrine system, okay, so these are procedures on the thyroid. Okay, under the excision category, CPT code 60210. 60210. Make sure you underline the term partial, okay, and unilateral. Okay, partial and unilateral. As you can see right underneath it, CPT code 60212 is indented, right? So that means it's taking on the definition from 60210, but stopping at the semicolon. So basically, the full description of CPT code 60212 is partial thyroid lobectomy, unilateral with contralateral. Contralateral means on the other side, by the way. Subtotal lobectomy. Okay? So contralateral means on the other side. You need to write that in your book. Okay? And CPT code 60220 is a total thyroid. So remember 60210 is partial. 60220 is total. Okay? 60225 is, it's continuance of 60220. But the 60210, the main thing there for me is partial, and the 60220 is total. That means they're removing the total thyroid. If you look on page 365, there's an image there. It says the posterior view of the pharynx. Okay. You see those 4 light blue dots? Those are called parathyroids. Those are called parathyroids. And they are actually attached to the thyroid gland. Okay. Just wanted to bring that to your attention. I'm still on page 365. CPT code 60240 all the way through 60270 are thyroidectomies. The codes we just previously discussed on 364 was talking about the lobes, right? The thyroid lobes. And now we're talking about a complete thyroidectomy. And it tells you 60252 is in reference if the patient has cancer, because it says due to a malignancy. So I write cancer right next to it. Okay. 60254 is still in reference to a malignancy or cancer. And it says radical neck dissection. Remember, anytime you see radical, that means they're removing the lymph nodes. So right now I'm looking at CPT code 60254. Right? That's the radical neck dissection. So that's a thyroidectomy for someone that has a malignancy, and they're also going to remove the lymph nodes with CPT code 60254. Okay. And moving on down to CPT code 60500. 60500. That's the parathyroidectomy. What's interesting to me with this particular CPT code is that the parathyroidectomy, that means they can remove the parathyroid, right? Then it says or just exploration, or they can just look. So that code 60500 is actually to remove it or just to explore. So it has a multi-purpose use. And that's pretty much it for the thyroids on what you need to know. It's only it's not only half, not even half a page, but it's going to be in reference to the thyroid, because if you turn the page to 366, you're basically done. Remember that you're going to be coding based on the levels, right? So in the 60,000s, you're going to have your thyroid, and then you'll also have the nervous system, which we're going to go into right now. And then you have the eyes and the Adnexa. So that's what, and the eyes are pretty short. So you only have 10 questions from all of those three categories. Okay, so 60500, oh, cancer of the thyroid. What was the code for cancer of the thyroid? That was 60252. Thank you, 60252. And if they're removing the lymph nodes, in addition to that patient that's having the thyroid ectomy for the cancer, then you would use 60254. 60254. Just want to get some terminology here. Remember, I will be sending this out to you where you can pause it and just, take some of the terms that you see. Just trying to see which ones I need you to know on this one. Okay, so as far as the anatomy of the endocrine system, there's two large lobes. So when they're talking about the lobes, partial thyroid lobectomy or total thyroid lobectomy, that's what they're removing, the lobe, part of the lobe or entire lobe. Okay. Main function of the thyroid is to regulate the how you process things throughout the body, metabolic rate. And two terms, hyperthyroidism and hypo. So hypo means low or little, and hyper means overproduction of the hormone. And the parathyroid, which are the four blue specks that you see on the image on page 365 in your CPT, are located on the lateral lobes of the thyroid. And again, they help to metabolize. So the conditions, there's two conditions they've discussed here, hypocalcemia and hypercalcemia. So they have hypocalcemia results in sustained muscle contraction. Hypercalcemia is the result of being tired, fatigue, some of the symptoms, constipation, and kidney stones. Let's go. And then you have your thymus. They won't ask questions on the thymus, but I just want to have this here for you. So it's a large organ in the fetus, grows until puberty, secretes hormones to control immune function. Thymectomy, again, ectomy is the removal of, and so it's the removal of the thymus. Okay, let's get to the coding. Okay, so going into the nervous system now, which starts on page 367. And again, just like I do on the previous weeks, when I send the attachments to you, I will also include the need to knows for this particular section. All right. As far as the nervous system, you see I have them in red. That means it's very important. I need you to know them, right? So this is on slide 12, the nervous system. So the central nervous system consists of the brain and the spinal cord. And the peripheral nervous system are exactly that, the nerves running through the body. And it coordinates our function of all the organs. Okay. So you need to know, usually they'll ask, what are two parts of the CNS? And you'll say brain and spinal cord. And more anatomy, because the nervous system is quite complex. Let's see, I was trying to see where you could write your notes. Page 400 is a nice blank page for you in the CPT to make sure you write your notes for this section and your need to knows. Page 400 is a nice blank page. Right. And so I thought they would have had an image. Oh, yes. On page 368, you'll see the image of all the nerves running through the body. And your dendrites are at the ends of the nerves, which receives impulses. Lets you know when things are hot and cold, when you touch. Let's see, where are we? And this is just more terminology. So definitely, as far as the anatomy and terminology portion of it, you want to make sure that you are reading your text, your textbook. Because I want to make sure I can get to the CPT portion for you. Okay, this slide here, when you review the presentation, because I can't just leave it up for you to write them all down, or you could always screenshot. Everybody know how to screenshot, right? You just do print screen, and then you can paste it onto a Word document because you can actually screenshot this actual screen as it's up. But it's important for you to know the different nerves and for the different areas for the nerve plexi. So you have cervical, which consists of the head, the neck, and the shoulders. And brachial, chest, shoulders, arms, and hands. Lumbar is pertaining to the back, abdomen, groin, thighs, knees, and calves, and your sacral. Your pelvics, your buttocks, genitals, thighs. So these are the nerves that run through those particular areas. And the reason I'm bringing that to your attention is because sometimes in the questions, they will just say lumbar nerves, and you need to know what body parts. Is you still see the homework? Is everyone seeing the slide? I want to make sure you're seeing the PowerPoint. Is everyone seeing the PowerPoint? Oh, okay. Because I still saw someone saying they were seeing the questions. So the PowerPoint is up. Okay. All right. So here again, here are the nerves. And you see how they have C1 through C8. So these are cervical, right? And then you have T1 through T12. Those are your thoracic nerves. And then you have L1 through L5. That's your lumbar. and then S1 through S5. That's just sacral nerves. So that's how they're, these just a good image of the nerves that are running through the body. And remember when we were in musculoskeletal and they were doing like the discectomies and the interspaces? This is kind of similar. It's pretty much similar. So they're just, the nerves are just broken into regions. Okay. So again, we just spoke about the different types of nerves and the body parts that are located in each of those segments. The cervical, thoracic, lumbar, sacral, and coccygeal. Well, they won't ask coccygeal. Usually it's this last one. Anytime you see L5S1, that's the last space of the lumbar, first one of the sacral. Okay. Spinal cord functions, what are they? Right? They send information to your muscles, send info to the brain, and they also are in control of your coordination. And again, we'll talk about segments and interspaces. So when they talk about segment, they're talking about the actual bone. So if they say T5, it's the fifth thoracic segment bone. And interspace could be just like when I stated L5S1, that's the last lumbar, first sacral, in between that space. Okay? And then it tells you what the segments are made up of. And if they're doing facet joint injections, because that's going to be something you'll maybe have to code, facet joint injection, it's one per side where the segments meet. But we would have to see a question for you to understand, for it to make sense to you. So facet joints, when they're doing injection, they do them on each side. And it will be stated in your question. Okay. Cerebrum, the largest portion of the brain. You need to know that. Okay. Cerebrum is the largest portion of the brain. And of course, it's divided into hemispheres. And cerebellum, I think this is a terminology word. I should actually have that in red. Cerebellum is a coordination of your voluntary muscles. Remember, your voluntary muscles are the ones you have to move yourself. Okay, so that takes a lot of brain power there. Okay, brain stem connects to the spinal cord. And your ventricles contain cerebrospinal fluid. Sometimes they'll just use the acronym CSF. Okay, and I think you guys are pretty good with endocrine, and that's where all your diabetes and that type thing comes up. Remember, very, very important about your coding guidelines, especially with diabetes. Okay. And it gives you, that's your E, that's for nutritional, metabolic. Where did I want to go? Chapter 2. It tells you report your neoplasm first. And additional diagnosis as a result of the neoplasms are reported secondary. But of course, you would know that because you would review your coding guidelines. And these are just some of the common disorders. They're going back to endocrine here. Let's get to, okay. Meningitis, inflammation of the lining of the spinal cord and brain. This is also inflammation of the brain, myelitis, inflammation of the spinal cord. And encephalomyelitis is brain and spinal cord. Okay, it's just talking about some of the conditions here. Talking about how to code when someone has pain. G89 is the I-10 code for pain. This is when pain is the reason for the visit, not just like back pain. Pain control. And it tells you do not report if you know the underlying cause, because that would be listed first. So they talk about pain, so that might be a little indication for you when you're doing your readings this week to just look at the coding guidelines in reference to the nervous system and for the endocrine. Let's get to the codes. All right, we just did that one. Okay, nervous system. All right, so right now I'm looking at page 367. 367. Just like your previous chapters, I'm going to repeat myself. Just that in the nervous system, we're not just talking about body parts now, right? Because we're talking about the nerves. So you're going to have different approaches in this particular system. Okay, so right now I am looking at page 367. On page 367 in the red, you can see that these are going to be procedures on the skull, meninges, and the brain. Okay. So you always, again, you're going to look and see what's the body part. What's the part they're getting ready to perform a procedure on. On page 367 is going to be the skull, meninges, and the brain. On page 368, these are going to be procedures on the spine and the spinal cord. So let's look at some of these options here. Under spine and spinal cord, you have your injections. They have catheter implantations, laminotomy, laminectomy. In the nervous system, very, very, very important that you pay attention to the spelling of the terms because they sound very close and they have different meanings. Okay, so you're going to notice that in this particular section. Okay, so they have excision by laminectomy. They have repair. You're definitely going to have a question on shunts, which they're saying is found on page 390. And then on page 369, they start procedures on nerves in the head, right? Extracranial nerves. This section, no one ever fails this section because the answers, just like musculoskeletal, are going to be, they're not going to be close. They're not going to be close. All right, right now I'm on page 370. 370. Okay. This is under the skull, meninges, and the brain. We're starting in the nervous system. First thing I want you to take a look at is a CPT code 61105. That's CPT code 61105. You notice I want you to highlight or underline where it says twist drill. Okay, twist drill hole. And then CPT code 61154, where it says burr holes. And basically, a twist drill hole and a burr hole is a drill that is an actual drill that's used to go into the skull. Now, when they're using a burr hole, is like if someone hit their head, right, and it's swelling, and they've gained a hematoma, and they need to release the pressure. Right? They need to release the pressure. They're going to use a burr hole. The burr hole is bigger. The burr hole is bigger than a twist drill hole. Okay, the twist drill hole that's on page 370, CPT code 61105. They use a drill in there like if they needed to insert a lead, like a monitoring lead or a catheter. So like in CPT code 61107, you can highlight drill hole. And then also highlight where it says implanting ventricular catheter. So you know that's for the very minute, small devices. Like I said, a catheter or a lead. The burr hole is going to be to release swelling, or so that brain doesn't explode through the skull. It's for like a hematoma. So a key thing I want you to highlight in CPT code 61154 is hematoma. Hematoma. So there you have explanation of twist drill and burr holes. Those are maybe the two they'll ask about on this particular page in reference to procedures performed on the skull. So you just have to remember that the twist drill hole is for implanting like a catheter or a lead, and the burr hole is to release pressure for someone that has like a hematoma. And those keywords will be in your question. So they also here on the slide, it tells you perform for injections, drainage, insertion of device, dye, or contrast. So if I'm going to use, I'm just going to ask you, you can put your answer in the chat box. If I was going to do a biopsy of a brain or a tumor, which one do you think I would use, a twist drill or a burr hole to get a biopsy? Yay. You guys are even giving me the, I like that. You're even giving me the actual code. So remember, if you're going to do a biopsy, you're not going to use like a twist drill hole because it's not going to be big enough to abstract that specimen. Remember, the twist drill is going to be for something really thin, a ventricular, a catheter, a lead. But if I'm going to release pressure, I'm going to need a larger drill. Just think of it that way. Or if I'm going to do a biopsy, I have to make sure whatever device I'm using can abstract that biopsy. So it needs to be a little bigger. So biopsy burr hole, how about that? The B and the B's. Right? And then the twist drill will be for smaller devices, just if they're implanting a lead or a catheter or a monitoring device. Okay. Yeah, those are the two things I needed to know about twist drill and burr holes. Okay. On the craniectomy or craniotomy, you always have to consider the approach. Okay. Remember, otomy, the O stands for open, and craniectomy, that E stands for excision. That means we're removing part. Here, craniectomy, removing part of the skull. And craniotomy, I'm just opening the skull. Okay, so it tells you here, know the approach of the surgery. How do I know the approach of the surgery? The approach, if you're looking at page 370 in your CPT right now, it tells you the various approaches with the codes. Like if you look at CPT code 61312, it will tell you extradural or subdural, right? Or 61313 is intercerebral. So just always make sure you highlight those terms so you know that those are terms used to describe the approach. For the craniectomy and craniotomy. And make sure you understand the spelling of the word, because as you can see, CPT code 61304, that says craniectomy or craniotomy, so they're both categorized together, right? So either way, it's just the base of the approach that they're going in. So those won't be difficult for you to capture. And starting on page 370 all the way to 371 they're all talking about craniectomies and craniotomies. Until you get to CPT code 615, 30, then they're talking about the electrodes, subdural implantation of electrodes. Okay. On page 372, I want to go to surgery of the skull base. If I have that in red, so that means you're going to need to know, right? On page 372, where it says surgery of the skull base, you will see that they have definitions there. So please make sure you highlight them because you need to know the approach, whether they're going to have a particular procedure or whether it's going to be a biopsy. So this is reading information for you here because it talks about the approach procedure. Make sure you highlight that. The definitive procedure and repair or reconstruction procedures. It's just telling you how to code them. But again, like I said, this particular chapter, it seems kind of wordy, but it's not. It's not difficult. Okay. Again, you just have to look at, like let's look at page 373. It has approach procedures. And now you're just looking for the name of the type of fossa where they're going to do the procedure, right? So you have anterior fossa, then you have middle fossa, posterior fossa, and then you have base of anterior. So you're just looking for that in your question. Okay, I'm on page 374. And I don't have a lot of stars in this section because I will go over the need to knows in a little bit. I don't have a lot in this particular area because they don't even cover from here. Endovascular therapy. No, don't need that one. Where do we need to go? Let me tell you where I need you to turn to. You definitely need the neurotransstimulators. That's on page 378. Right now I'm on page 378. For the neurostimulators. All right, so under the neurostimulators, again, under CPT code 61850, remember they're inserting electrodes or catheters. So it tells you twist, drill, or burr hole to implant, depending on the size. Okay, so this is to implant a neurostimulator. Just remember in your question, if you see the term neurostimulator, you need to turn to page 378. That's where they start. 61860, craniectomy. Make sure you highlight the term craniectomy or craniotomy. Remember, those are grouped together. And in CPT code 61860, make sure you highlight or underline where it says cerebral cortical. Cerebral cortical. Okay. Cerebral cortical. And on CPT code 61863, make sure you highlight where it states neurostimulator electrode without use of intraoperative microelectrode. Without. Make sure you put a box around without. A box around without. All right, let's move on. CPT code 61867. They're talking about a twist drill or burr hole. As you can see with the neurostimulators, depending on the size of what they're inserting, they may use a twist or a burr hole drill. So under the neurostimulators, the twist and the burr hole drills are grouped together. Okay. CPT code 61867, make sure you highlight that last sentence where it says with use, because remember those 61863 was without. 61867 is with use of intraoperative microelectrode. And on page 379, CPT code 61885, that's for the insertion. So make sure you highlight insertion or replacement of the cranial neurostimulator, generator or receiver. So that's for the insertion of the neurostimulator. Okay, so as you can see on page 378, we're just using the devices to go in, to open it up, right? And then on page 379, it's what we're implanting once it's been opened. Okay, 61885, again, is insertion or replacement. So you need to know how many electrodes. And 61880 right above it, that's a revision. And so is 61888. So 61888 is revision or removal. And what are they removing? The pulse generator or receiver. With CPT code 61880, they're removing electrodes. And remember, your pulse generator, if you're not familiar with what a pulse generator is, that's the battery. It's the battery. So that was for insertions or revisions. And then you can see it goes to repairs. Okay. Okay, and then we're talking about the shunts. That starts at the bottom of page 379. And again, just remember, once you know the body part, for example, spine and spinal cord, you can look on page 368, right, your reference page, and you're like, okay, what are we getting ready to do to the spine and spinal cord? So basically, just to recap a little bit, when you're doing the nervous system, you're looking for the body part. There's a lot of procedures, but they're only grouped into like 4 categories or 3. So on page 367, it's either going to be the skull, meninges, and the brain, or it's on page 368, it's either going to be the spine or spinal cord. And then 369 is talking about all the nerves, right? So you got your nerves, spine, spinal cord, and the head. So head, spine, spinal cord, and then the nerves. Once you know what category, then you can choose that page, and then you're going to say to yourself, what are they getting ready to do to that particular area? And like I said, it's not hard, because if you look at the blues, like for example, I'm looking at page 369 right now, and I see, okay, that's obviously, if I'm looking at page 369, the question better be in reference to the nerves, right? And I'm asking myself, what are they getting ready to do? If you notice, the categories that are listed in blue are not duplicated. So it's going to be very clear on what the procedure is supposed to be and what page you need to go to get your answer. So when you get to the nervous system, although it seems to be very wordy, you just have to think to yourself, out of those 3 sections, which one are they talking about? And what are they going to do once I get to that section? Right? Because if they're going to do, what does this one say? Chemodenervation, then I need to know, is it going to be at the somatic nerve or the sympathetic nerve? You see that? Because those are in black. It's like a sub-indentation, providing additional information. Somatic nerves, I know I'm going to turn to page 394. If they're talking about sympathetic nerves, I'm going to turn to page 396, right? Or they may just say neurostimulators. So we know they're talking about nerves. They said neurostimulators. Where am I going to go? I'm going to go to page 393. So again, what I'm trying to make clear is that you would break it up into 3 sections in the nervous system. You can use, this is one of the systems you would want to utilize your reference pages because of the detail. See, with anesthesia, it was a little different because it's anesthesia for just different body parts. So we can turn to the index and we can go to anesthesia. We can look for the body part right away. But with the nervous system, it's so detailed that it's easier to group it by out of those 3 sections and then figure out what they're doing within those 3 sections by looking at the page. Okay. Hopefully that helps. A little tip. All right. Let's see where we are. So we were looking at the spinal cord, cerebral spinal fluid. I'm sorry, yeah, from the shunt. So I was looking at page 379. On page 380, remember, these are going to be procedures in reference to the shunt. If you don't know what a shunt is, there is an image on page 380. And you can see the catheter, how it's been inserted. And there's different procedures that can be done for these shunt procedures. CPT code 62225, that's the replacement. And look, it says replacement or irrigation. So irrigation is important to stand out. Or you have 62230, replacement or revision. 62252, reprogramming. I'm just highlighting, the key terms in each of those CPT codes. So when I turn to this page, okay, I know they're doing something with the shunt. What are they getting ready to do? Replace it, do a revision, reprogramming, remove it altogether, which would be 62256, or are they going to remove it and replace it? Right? So if they're going to remove and replace, you only use 62258, right? Because that's removal with replacement. Okay. And that's it for the shunt procedures. And I'm pretty sure they're going to ask you one from that category, and it's pretty simple because all you're really doing is looking at that first term. You know where to go, and now you're like, what are they getting ready to do with that shunt? Okay. Then we move on down to the spinal cord, the spine and the spinal cord. And it gives you, this is information that you can read. It tells you how to code if it has, if they're using any radiology, what those 2 CPT or 3 CPT codes should be, if they're using radiology for guidance. But this is just for your reading so you can understand the concepts. But again, in this particular section, the questions aren't going to be too difficult that you wouldn't be able to find it by looking at each of those 3 categories and finding out what's happening in that particular category. Okay. In reference to the spine and the spinal cord. Laminectomy, laminotomy is where I need to be. So I am on page 384. Page 384. This is the area where I was stating that you need to pay attention to the spelling of your words. And there are steps to code for page 384 and 385. Okay. First thing you need to know, laminectomy and laminotomy. First of all, you're going to need to know what procedure is being performed. Okay, because if it's a laminectomy, it could start from CPT code 63001, right? And laminotomy starts from CPT code 63020. Okay, here are your steps. Step 1, okay, you need to know in reference to this procedure, is it going to be total or partial? Total or partial, or complete or partial? Step number 2, what body area? And when I say what body area, because if you look at CPT code 63001, it's in reference to the cervical. Do you see that at the end? 63003, thoracic. 63005, lumbar. 63011, sacral. So you got to make sure you highlight those body regions, and you also highlight the main term, which is laminectomy, for that range of codes. Laminectomy. So laminectomy means they're excising, right? E is for excision. E is for excision. CPT code 63020, laminotomy, right? So that's an opening. The laminectomy, they're removing some of it. 63020, they're opening. And look, there's that term again, hemilaminectomy. What does that mean? What does hemi mean? Okay, just remember that your hemi is partial. That's right. You guys got it. So you're not sleeping while you're at home. You're actually in your books. That's great. So yes, partial is correct. So if I see laminotomy and it says hemilaminectomy, that means they're only doing a partial removal, right? That's what that means. And make sure you highlight the body region with 63020. Now we're talking laminotomy, so that's opening, and it's of the cervical interspace. 63030, lumbar. What's also important is if it is bilateral, if it says bilateral in the question, you make sure you append modifier 50 for the bilateral procedure. Okay, so that's one interspace. Did you see that? CPT code 63030 is one interspace, and then you have 63035 for each additional interspace. So if they had L1 through L2, it's only one interspace. It's not two interspaces. It's the space in between both of those lumbar laminas. Okay? So if you see L1 through L2, it's only one interspace. Okay? Yes, ectomy is removal, because ectomy is like the excision. So ectomy is removal. Otomy is opening that area. They're opening the area. So you have your first step. Is it complete or is it partial? Excision of the lamina. Remember those little discs on page 384, that image right there is the lamina. So you have a good idea. And you see there's one on top, one at the bottom. So in between is an interspace. In between is an interspace, and running through that blue, running through is going to be your spinal cord with the nerve roots coming up, and then you would have your nerves actually coming out of those roots. And then, of course, the second step is what area, whether it's cervical, thoracic, or lumbar. And then the third is decompression mentioned in your question? Does it include decompression? And when you are coding for decompression, it gives you the code range there, 63055, which is on page 385. You have to also consider the approach. So those are the make sure you highlight where it says decompression. discectomies. One of the modifiers I wanted to mention, just like I spoke about 53 and 52 with the digestive, with the nervous system, they have modifier 62 here, which means there's 2 surgeons performing the procedure. One surgeon could just be turning the patient for exposure while the other one goes in, because remember, these are procedures on the spine or on the spinal cord, or in that in the on the or with the nerves of the spinal cord. They could be performing procedures on those areas. So 62 is co-surgeon. There's also modifier 80, which they don't have here listed, and that's assistant surgeon. So modifier 80 is for assistant. Modifier 62 is a co-surgeon. And also modifier 66 may be something they would use with nervous system procedures. And modifier 66 is a surgical team. It's a surgical team. And also if this is being performed on a baby, like a newborn that's maybe less than 4 kilograms, they would use modifier 63. Okay. So we already spoke about the laminectomies and laminotomies for the disc. Let's see. What else do I need you guys to have in this one? On page 386. On page 386, let me go back. I think they spoke about, corpectomies there. CPT code 63087. That's a vertebral corpectomy. What I want you to highlight in that CPT code description is where it says complete combined thoracolumbar approach. Make sure you highlight that in CPT code 63087, where it says, well, it's actually partial or complete combined thoracolumbar approach. So of course, at the top of the page, you have to make sure you write consider the approach, because in CPT code 63090, what's the approach? It says transperitoneal or retroperitoneal approach. Okay, so with the vertebral corpectomies, which is found on page 386, you have to consider the approach in which it is performed, and note the second step is how many segments. How many segments? And that will be in your question. Just like it says in CPT code 63090, that's a single segment. A single segment. And 63091 is for each additional segment. But again, make sure you consider the approach. What else do I need you to know for nervous system? Page 388. Page 388. CPT code 63307. As you can see, it says intradural. Make sure you highlight that, because if you're looking at CPT code 63301, that says extradural. And again, I think these are a little easier because it gives you so much detail in your CPT description. 63301 is talking about thoracic. Look at the approach. So you want to make sure you highlight the approach, so those terms stand out to you when you're looking at this page. Because if you don't highlight and make the words jump out at you, they kind of all run in together. right? But if you're looking at 63301 and you highlight extradural and then you highlight transthoracic approach, and if you look at 63302, it's also extradural, but that's thoracolumbar approach. So if I had to ask you, important things you need to remember for the nervous system, you're definitely going to tell me the approach. And then to what particular level, whether it's cervical, thoracic, or lumbar, right? That's going to be important on where they're performing the procedure in the nervous system. Kind of like the same thing again with musculoskeletal, it's the same thing. Okay. All right, so we're talking about pulse, spinal neurostimulators, right? And spinal neurostimulators and stereotactics, radiosurgery is on page 388, and then it goes on to page 389. Okay. And again, we are talking about procedures on this. We're still on the spine and the spinal cord. That's why I said you can go through all of these pages, or you can look on your reference page, right? Because if you read your question and you noticed that they were talking about, you already figured out it's the spine and the spinal cord, right? Because it's going to say that in your question. Once you turn to that reference page and you're reading your question, you're like, okay, they're getting ready to talk about neurostimulators. I can see that in my question. You can look right on page 368. You can look at spine and spinal cord. And I'm like, okay, neurostimulators, spinal. Where am I going to go? What page? 389. So you see where I'm going? Once you're reading your question, find that body part. This is the direction or the directives to follow for nervous system coding. This is definitely one of those chapters I'm going to say, what does your reference page say? Where does it tell you to go? What's the body part? What's getting ready to happen? What are they getting ready to do to the spine and the spinal cord? It's only going to be what's listed here, right? It's only going to be what's, the procedures that are listed right underneath it. Like we were just talking about, excision means to remove. If we're talking about excision from the spine or the spinal cord and we're looking on page 368, you're going to say, okay, well, we're either going to be doing a laminectomy, right? Or we're going to be getting rid of some of those intraspinal lesions. That's going to be in your question. It's going to be in your question. Let the questions guide you. As I stated, it seems pretty wordy, but it's very exact on what they're going to be asking and what they're going to be looking for. So I'm back on page 389. So you can see that was the neurostimulators. Depending on your question, again, are we removing? Are we inserting? Right? Because CPT code 63650. Percutaneous. What does percutaneous mean? Percutaneous means through the skin. So they're going to implant a neurostimulator. The way they're going to get it in there is through the skin by epidural. Or in your question, it's going to say laminectomy. Patient came in, had a laminectomy performed for insertion of a neurostimulator. CPT code 63655. Or that was insertion, right? Implantation. You go down to 63661, removal. 63663, revision. So again, find your body area. What are they getting ready to do to that area? Turn to that page. Once you do that, if you use those two steps, then you look at your ABCD, right? So you have an idea of what those CPT definitions are. Then you go back to your question. Nervous system should not be a problem for you. I'm right now on page 390, where they're talking about extracranial nerves. It tells you there's 12 pairs of cranial nerves, 31 pairs. They won't ask questions like that. This is just FYI. 31 pair spinal nerves. And then they talk about the peripheral nervous system. So, and then they go into somatic nerves, and you can see that on page 390. If you look at CPT code 64400, you can see that's an injection, right? They're getting ready to inject. You need to know the name of the nerve that they're going to inject. They're going to tell you somatic nerve in your question, but you need to know what nerve is going to have that injection. Is it going to be the facial nerve, 64402, the greater occipital nerve, 64405, vagus nerve, 64408? I'd highlight the different names of the nerves, right? Because that's what you're going to need to know when they start talking about injections. Okay? And this is all the nerves. This is the third category, so that means this is the last one. This is the last section covered in the nervous system, right? Because we already knew by looking at the reference page that there's only 3 categories. We already covered or looked at a few of the procedures for the skull and meninges and brain, and then we went to spine and spinal cord, and then we wrap up with this last section, which is all of the nerves. See, it's 3 different categories for the nervous system, right? And then once you get to the nerves, which is where we are, in your question, they are going to identify the various types of nerves. Like you see here on page 390 is somatic. If you turn to page 392, paravertebral, atomic, right? Same thing. I could look back on page 369, which is my reference page for the nerves. Same thing. I could look under nerves for the injection, right? What did I say? You need to know what nerve. The 3 are listed right there. 3 are listed right there. So once you identify the nerve, then you get there. Let's say we're looking for the somatic nerve. It's already going to tell you turn to page 390. So now I'm at 390 and I know it's somatic nerves. Now I'm like, which nerve of the somatic nerves? Facial, vagus, right? Phrenic, cervical plexus. It's going to be mentioned in your question. That's why I said this one, it kind of narrows everything down for you because the CPT code definitions are so descriptive in this particular area. Okay, I'm on page 392, and these are going to be the facet joint injections. Facet joint injections. Facet joint injections on page 392. Same thing. Just want to double check that. I'm going back to my reference page. You got to start practicing moving back and forth through this book. So they don't have, do they have the facet here? Your facet joint injections start 644. These are still injections. These are done by levels. Yeah, those are still going to be under your injections. I'm sorry, yeah, under the different nerves. But if you look at CPT code 64493, 64493, you can see it's an injection. It says diagnostic, right, for them to diagnose, or therapeutic for them to treat. So either or, it's under the same injection. And what's the name of my, it's a paravertebral facet joint injection. And it says with image guidance. So guess what? You don't need to code a radiology code with this because it's already included in the CPT description. And with this particular CPT code, it tells you the areas. It already mentions lumbar or sacral, single level. So when you're doing the facet joint, when you're coding for facet joint injections, you want to know how many levels. How many levels? Because you can see 64493. And remember, I spoke about if it was done on both sides, you'd use modifier 50, right? Don't forget that. If the facet joint injection is performed on both sides, you would use modifier 50. And then you'll also want to know how many levels. Because if it says 2 levels, then you'd have 64493 and 64494. So those are in reference to the facet joint injections. Those are usually for people that have a lot of nerve pain. And as you can see on the screen, on the slide, when they do the injections, it's basically unilateral. So they're always saying it's being performed on one side. That's why I stated if it states in your question bilateral, that is an indication for you. You need to write it in your book. If it says bilateral, I need to use modifier 50. Right. And it gives you the steps here too. Do you see those steps? Is it the somatic or sympathetic nerve, the number of levels? And if it's an infusion, which you won't cover until we get to medicine, how long is it for? What the length of time would be. Okay. Let's see what else we got. Page 396. Page 396. Let's see. Again, on page 396, chemoderivation. Again, if I go to my nerves on my reference page, I can look just for that term, and it's going to tell me what page to go to. Now, let me go back. So we're on page 396. Look at CPT code 64642. 64642. Highlight that. Chemoderivation of one extremity. So I guess you need to know how many extremities, right? How many extremities? And it says one extremity, 1 to 4 muscles. So how many extremities? How many muscles? And then there is an add-on code for additional extremities. So don't get the extremities confused with the muscles, because that's one extremity, and then additional extremities. And then it breaks it down. If you look at sympathetic nerves, same procedure. But then it's stating both axillae. So it could be your arms. Which ones? It could be both or. So again, that's under chemoderivation. On page 397, I just want to point out 2 CPT codes to you on this page. First one is 64718. 64718. Please remember this stands for where it says the ulnar nerve at elbow, that's the upper arm. Elbow is considered the upper arm. And then from the ulnar to the wrist, that's going to be the lower arm. So 64719, I want you to write lower arm. 64718, next to it, you'll write upper arm. Because sometimes in the question, they'll just say it happened in the lower arm. right? Or they'll say wrist, and you'll only have upper or lower arm to choose from. So just make sure you have upper arm written next to 64718 and lower arm written next to 64719. 64719. And you can also see that on these two pages, it's broken down by the different types of nerves, right? You have sympathetic nerve on page 396, somatic nerves on page 397. And turn to page 398. At the top of the page of 398, you need to make sure you write the name of the nerve. You need to know the name of the nerve that's going to be addressed on this page. The name of the nerve that's going to be addressed at the top of the page. And at the bottom of page 398, again, this is still in reference to nerves, the last section of those three categories that we just divided it into. We have the skull, meninges, we have the spine, spinal cord, and then we have the nerves. So we're still on the nerves. Neurophy on the bottom of page 398. What does that mean? To suture. So they're suturing the nerve. Okay. So the name of the nerve, I said to remember the name of the nerve. 64831. Suture of what nerve? The digital nerve. Where is it located? Hand or foot? Okay, how many nerves? One nerve. What if I said two nerves? Then you're going to need 64831, 64832, right? It's dependent on each other. Look at CPT code 64834. It doesn't say digital nerve. It says common sensory nerve. Make sure you highlight that. Right? So the 64835, 64836, it's giving you the names of the nerve. 64858 is a common one, suture of the sciatic nerve, right? Make sure you highlight that. 64856, peripheral nerve. So hence why you have at the top of the page, you need to know the name of the nerve. And then towards the bottom of page 398 on the right-hand side, these are also suture of the nerves, but a graft is involved. Right? So as you can see, these are all nerve grafts. What you need to know there is how many strands. They have single strand, multiple strand, and then the length. How much, of the graft are we using? Up to 4 centimeters, over 4 centimeters. That's something you'll be looking for in your question. Okay, so that's what the last part, page 398 and 399 are talking about the nerves, and then it further divides it to the suture of the nerves involving the grafts. Okay. Also here they have what they call a to do these, because remember it's nerves, you're sewing up a nerve. You know how little those things are almost invisible, right? So they use what they call sometimes with the procedures an operating microscope, 69990. So it's always important to know before you add on, if you read in the question that he's using an operating microscope, always look in the CPT definition to see whether it's included or not, whether an operating microscope is included or not before you code it. That's why it states on this slide, beware of the bundling. Okay. Okay. And on page 400, that would be blank for you. That's where you're going to put your notes and your need to knows that I'm going to send you for the 60,000 category. And to wrap up tonight, I'm going to be real quick on the eyes. The operating microscope, just for you to have an idea, that's on page 422. Page 422. And then we're just going to wrap it up with the senses really quick. Won't take too long. So right now I am on page 401. So as you can see, it's not that much. It's only a page and a half. Let me just change out this PowerPoint to the eyes. Anyone have any questions? Let me open up the line. Anyone?
Nope.
Nope. You're like, let's keep moving. All right. No problem.
No for me, I should say that.
Okay. I think you speak for everyone. Everybody's like, yep, sounds good. Let's keep going. So, like I said, this one isn't, it's not hard. It's not hard. Let's see. You just got to make sure you read and make sure you pay attention to the spelling, because like I said, it can get really close. All right, where are we going with this? All right, so everyone should be able to see the eyes auditory system. Please let me know.
Yes.
All righty, here we go. We're on the home stretch, people. I know it's exciting. How many of you have gone ahead and registered for the exam? I know quite a few of you have already. And again, remember that I am going to send the 2 additional dates to take your exam. December 10th and December 17th are the 2. Yeah. Don't wait too long though, because if you do happen to have to retest, you'd maybe want to retest before the end of the year. So I've always say I would give November. What date did we have in November? The 19th. November the 19th. I would try my test, see how I do. At least I have an idea. Because if you take it in December and you're not successful in December, I won't have any test dates for January. My first test date for 2017 isn't going to be until April. It doesn't mean you can't test elsewhere, but my only concern with that is if and when they update the exam. Because remember, if there are new CPT codes, which there are new CPT codes all the time, if there is changes to I-10 with new codes, which there's over 7,000 changes this year for I-10 in just over 7,000 changes and updates, it may be reflected on the exam. When? I don't know. I don't write the exam, so I can't answer that. So that's why I always try and say, if you can, I would say try and test, with the year that you have your books for. So that's why I'm suggesting, usually it's about 30 days before the test date they want you to be registered. Usually it's about 30 days before. So you maybe have until what, October 19th to test, to make sure you're registered for November 19th. And again, I will be sending out sample letter on what the second letter needs to be. Okay, so if you have registered already, please email me and say, Geneve, I'm registered, because I need to send you my first letter also. Okay, so make sure you just say a quick email. I'd rather an email so you can have proof that you told me. And then that way I can respond with the letter from me as an attachment. And then what you need to do is just pay attention to the dates that you're going to use, and make sure you pay attention to getting your second letter, the second letter. I got you covered for the first one. It's just the second. And again, if you don't have 2, then you'll have the A designation at the end. And again, the exam, people do like to test with me, but you can test anywhere. It's the same exam that they're going to ship out to wherever the location may be. All right. Alrighty, so everyone should be able to see the screen. And again, don't forget to email me, let me know. All right. There are a few things that you need to know. So we're on page 401. As you can see, this is going to be in reference to the eyes and auditory. Let's see. Eyes and auditory, these are procedures on the eyes. This is when I used to, this chapter was really short, so this is when I used to like to do the dissection of the cow eyeball, but of course, it's not happening this term. But the eyeball, I'm on page 403. 403, and I'm looking at CPT code 65091. Let me see if it's in here. Let me see what I'm looking for. I need you to make sure, do you see that word evisceration? You got a little bit of homework. Well, you're going to have a lot of homework, but I want you to make sure you have the definition written next to the CPT code for these three terms. The first one is evisceration, which you can find CPT code 65091 on page 403. 65091. You need to have the definition for evisceration. Okay. CPT code 65101, enucleation. You need the definition for that. And 65110, extenteration. Make sure you have that. Okay. One is like removing the entire eyeball. One is you're removing the eyeball, but the muscles are still there, attached. And extenteration, let's see if I remember that one. That one I don't remember off the top of my head. So make sure that you have the definitions written next to the CPT. It will help you when you get to this portion of the exam. And again, this is the 60,000 codes, right? And there's only going to be 10 questions. 10 questions, meaning a couple from the eyes, a couple from the nervous system, and then a couple from endocrine. And there's only so much you can ask in endocrine. So I think you'll be well prepared if you make sure that you get the definitions for those terms. So depending on how, because sometimes they won't use the term enucleation, they'll just say remove the eyeball and the muscles remained attached. Right, so you have to know what those definitions are. So I want you to look them up and either write them on this page or write them on page 402 at the bottom. And also see on page 402 that they do have an illustration of the anatomy of the eye. They do have that there. Extenteration is what I was looking for. Let's see. Okay, so extenteration is a complete surgical removal of a body organ, especially the eyeball, and other contents of the eye socket, usually in cases of malignant cancer. So that's good. Something good to put down. That usually happens with, so 65110 would usually happen with a cancer patient. Okay. And when I did the cow eyeball dissection, we do look at the anatomy of the eye, so we are able to notice and recognize the iris, the pupil, the vitreous humor. That's all the jelly that's inside, the ligaments that hold the lens, and the actual shape of the lens, and the anterior chamber of the eyeball, which looks like a little rainbow that reflects color when you're looking at things. So it's very interesting to do. I know a lot of you weren't excited about that. Conjunctiva, some people have heard of conjunctivitis or the pink eye. And then the muscles of the eye, extrinsic, intrinsic, outside, inside. Yes. And these are just some, again, anatomy. Make sure you're reading your PMCC textbook. Okay. Otolaryngologist. or ENTs, your nose and throat. This right here should be in red, the middle ear. You need to know what is contained in the middle ear. On the slide, it states tympanic membrane, the ossicles, malleus, incus, and stapes. Those are the little bones in the ear, and also eustachian tube. Make sure you have those jotted down, what's involved or the components of the middle ear. And again, I will be sending this once it downloads or uploads. I'll send the link. I'm more concerned, I know they like to ask about the middle ear, but they do have the inner ear here. Okay, let's get into, and again, those are the three terms that I need you to make sure you have the definitions to: evisceration, enucleation, and extenturation. That is found on page 403. So there's only about 2-3 questions from this section, and that's what I'm going to cover. So I can give you back the rest of your evening. Let's see where I need to go. All right, I'm on page 407, intraocular lens procedures. CPT code 66982. 66982. Okay, that's the intraocular lens procedures. Okay, need you to see how much is involved in this one CPT code, right? So first thing you need to highlight in the CPT 66982 is extracapsular. So it's a cataract removal. So they are going to remove the cataract and also insert an intraocular lens. It says when they insert the lens, it can either be manual or mechanical. And they're also going to clean the eye by irrigation. Okay, so make sure you highlight that. And at the end of that CPT description, where it says, or performed on patients in the embryogenic developmental stage, make sure you highlight that. Okay, so just remember with this CPT code, they're removing the cataract and they're also inserting a prosthetic lens. And the way they're going to do that is either going to be mechanical or manual. And also, this is not usually for, what does it have here? Not generally used. The techniques they're using here are not generally used in routine cataract surgery. The routine cataract surgery, you're going to drop down to 66984. As you can see, it's almost the same. Extracapsular cataract removal with insertion of intraocular lens, manual or mechanical. And then 66985 is just the insertion. Keyword in those two prior CPT codes is extracapsular. And then you would just read the question to see what's involved, because you don't see irrigation and aspiration or phacoemulsification in your 66984. Wait, it does have irrigation, phaco. Let's see the difference. Who can see the difference between these two codes? Iris expansion, suture support. Got to make sure you highlight the difference between those two codes. Pretty sure you're going to have a question from right there. All right, what else do I need? Strabismus surgery. Yeah, that's on page 410. I'm looking now at CPT code 67311. 67311 is on page 410. At the top of the page, you need to type, you need to write what type of muscle is being affected, or what type of muscle. If you look at CPT code 67311, you will see that's the horizontal muscle. So you also need to know how many muscles, right? Because 67311 is one horizontal muscle, 67312, two horizontal, then you go into your vertical. So you definitely need to know what type of muscle, the name of the muscle. And as you go down, look at CPT code 67332, strabismus surgery on a patient with scarring of the extraocular muscle. So that means the lens of the eye. The muscles have been, they maybe could have gotten, a tear of the eye. Even rubbing the eye sometimes can do damage. So this is when they're doing the strabismus surgery on someone that has scarred their extraocular muscle. Okay, so, and it tells you your 67332 right underneath it, what codes you can use the 67332 with. Right? And on page 411, you can see the different types of muscle. You have your horizontal and those vertical muscles. I'm going to tell you that in this particular section, what they're really going to be focusing on is that cataract surgery that was on, well, those are procedures for cataract surgery. That was mentioned on page 407. Okay. They may also ask about scar release from the eyes, that CPT code 67343. So they're removing this scar from the eye without affecting the actual muscle. And you can also see in that CPT description, it says separate procedure. If you see separate procedure, what modifier may you need to use? Perfect. You guys are quick. Yep. Modifier 59. Remember, separate procedure is an indication that you may need to use modifier 69. And if you're looking at trichosis, is that how you pronounce that? I'm looking at CPT code 67820. That's basically when you have like a sty on the eye. They have the little image there. So again, in this particular section, you're going to pay attention. I'm pretty sure they'll maybe ask about the strabismus muscles surgery, the surgery for the cataracts, and then on that first page, page 403, where you're going to get those definitions and write them down, you need to make sure you understand those. And one more thing. Nope, is that it? Yep. Nope, that's it for the eyes. And then page 417. I'm on page 417. Oh, did I go back one thing? 6, 7. No, you're good. You're good. All right, auditory. So that was it for the eyes, and then we go on to the ears. And for the ears, as you can see, you just need to know the part of the ear that they're going to perform. The procedure on page 417 is divided. Usually they ask questions in reference to the temporal bone and the middle ear. That's why I needed you to make sure you know the anatomy of the middle ear, which you are going to write those down. Sometimes they'll ask questions. In ears, you have to think about common procedures. For me, I'm thinking about impacted serum, which is a buildup of earwax on page 418, CPT code 69210. CPT code 69210 is the removal of impacted serum, right? 69210. And if you notice, that particular code says unilateral. So it's only on one side. If they mention bilateral removal of impacted serum, then you know you are going to need modifier 52, as the description in 69210 only states unilateral. Okay, only states unilateral. On page 419, tympanostomy, which is CPT code 69436. That's the opening ostomy, tympanostomy. That's the ostomy means opening, artificial opening, and that's the procedure that they do before they insert tubes, the tubes into the ear. And that is actually performed in the middle ear, And tympanoplasty, which is on page 420, starting with CPT code 69635, tympanoplasty. That's the surgical repair of the middle ear, tympanic membrane. Make sure you highlight that. And under the category where it says other procedures, they talk about the implantation of a hearing device. So these are hearing devices. CPT code 69710 is either the put it in or replace it, implantation or replacement. 69711, removal or repair. So all of this is, so next to other procedures, you might just want to put hearing device just so you know that that's that particular category. 69714 is also an implantation. Osseo-integrated implant. That would be mentioned in your question, by the way. And then 69717, I have a star next to that. That's for replacement, including removal of existing device. Osseo-integrated implant. I think that is it. Okay, and on page 422, again, it talks about the operating microscope, which you see has a plus sign right? So that means it can't be used alone. It goes along with other procedures. And right above it in the green text, it tells you, can you use modifier 51? No, because it's an add-on code, so you wouldn't use modifier 51 anyway. And it tells you what I wanted to bring to your attention. It tells you the codes where the 69990 is already part of. So remember, I was like, make sure you read and see if the operating microscope is already included in the description. Well, on this page, it actually tells you the codes in which it's included part of the description already. It would be bundled into that CPT code that's listed above. All right. Let me see. I think that's it on this. Just going to make sure I will be sending out the need to knows for the 60,000s. Just making my little list here, what I have to send to you. And I'll open up the line too while I'm making my little list on what goes out to you tomorrow morning. Okay. So we will have your need to knows for the 60,000. Also your example letter for the exam, along with the additional index numbers. Your homework. Am I missing anything? Oh, PowerPoints and attachments. PowerPoint link. I'll send you the link to the... Do you guys want the recorded presentation or the actual PowerPoint itself? The line's open so you can speak.
I would rather have the PowerPoint.
Okay.
Because when you mention in the recording, when you say this is in red, if we only just have your voice recording, we won't know.
Well, the voice recording does come with the actual, what you're seeing.
Oh, okay.
So it will be just this.
Everybody. Yeah, I see everybody else saying PowerPoint too, because they probably was thinking the same thing. Okay. I didn't know that.
Oh, that tells me that no one's been watching my links. Aha.